Good morning. So this morning I wanted to pose an interesting question. Can you walk off diabetes? Once you have become a diabetic, can you become a non-diabetic? Now, I have to give a little bit of background, history, context, because there's some debate, like if you have bariatric surgery or such, that once you've had the surgery and you lose the weight, you're able to stop some of the or all of the medications that you were on before you had bariatric surgery, then some would say that you've basically cured the conditions for which you were on the medication. And I've struggled with this myself, because one of the things we say in medicine is that once you're a diabetic, you're always a diabetic. And so bariatric surgery kind of muddied this picture a little bit. But after careful consideration, I have to humbly disagree with that viewpoint. I've seen way too many people, after they had bariatric surgery, regain the weight. And guess what happened to all the conditions that existed prior to the surgery? They all came back, most of them with a vengeance. Now, when that happens, what you have now, when you have a person that's trying to manage all these conditions they were trying to manage before, but now we've permanently and radically changed the way their body absorbs nutrients to the point that they can't even really absorb vitamins, basic vitamins and minerals the way they used to. They have to take supplements for the rest of their life in order to be sure that they get them in. So now they have the additional burden of all the medical problems they had before, and now they're kind of starting, seems like they're further in the hole. To me, it's safer to assume the same viewpoint that a born again Christian has regarding whether or not they're a sinner. See, before Jesus, I was a sinner. And now that I have Jesus, I'm a sinner saved by grace. And it's important that I remember that, because I always have to understand that deep inside, my basic nature is to want to be selfish, to do sinful things, and to basically not care about anybody but myself. And it's only by remembering who I was and the things that he's brought me through that I can prepare my heart to love others and to be of service to others and to care more about others than I do myself. Now, related to your health, it's the exact same thing. If your blood pressure has ever been high enough that they had to give you medication even one time in the emergency room, you have high blood pressure. If your A1C has ever been above 6.5, you're a diabetic. If you've ever had a stroke, this part's going to be easy for you to understand. If you've ever had a stroke, you can never return to a status before you had a stroke. If you've ever had a heart attack, you will always be a heart attack survivor, and you'll always have the coronary artery disease that led to the heart attack. Now, you can manage your health to the point that it removes all physical signs. If you've ever had a stroke, you can, through work, healing in Jesus, you can get to the point where no one that doesn't know you would ever know that you had a stroke. But that doesn't mean that you're not a stroke survivor. You can make your chronic conditions undetectable, and that should be a goal. But they're still there, and they're waiting to cause more harm if you forget, and you allow yourself to fall back into previous patterns. Today, I am 50 pounds less than my highest weight. I was morbidly obese, and now that morbid obesity is not detectable. But if I go back to all my old previous habits, I will once again return. The morbid obesity will return. I'll probably might even be heavier than I was before. So to remain vigilant, I have to continue to practice the habits that got me here. If I want to maintain this hard-won health, I have to maintain the habits. And the best way for me to do that is to remember where I came from, and to remember that inside there's still an obese man ready to get his grocery on, for lack of better terms. So go ahead, walk off diabetes, I'm not discouraged. I don't want to discourage you. Absolutely. Get to the point where it's undetectable. Get off your blood pressure medicine. If you want to know how I did it, leave me a message and I'll send you a private message. If you want to know how I lost the 50 pounds, then by all means, that's not the point of the video, but by all means, I'm an open book. But never forget the diabetic is still within you. Never let that diabetic have control of your life again. I love you all. No buts.